The last category of drugs we have to cover are the inotropic drugs, and these are sometimes called cardiotonics. We talk about these on page 153, sorry. They're sometimes called cardiac glycosides, and the main one is digoxin, as you can see from this picture. Digoxin is the prototype drug, and the trade name is Lanoxin. And the cardiotonics, or cardioglycosides, are mainly taken for two reasons. One is to increase the contraction strength or force, so they make the heartbeat harder than it ordinarily would, more strongly. That's called positive inotropic action, if you make the heart beat more strongly. It's also designed to slow down the heart rate. What happens when you have a congestive heart that is going into failure is, to try to make up for its weakness and its enlarged size, the heart's going to beat very rapidly, and it's not going to beat as strongly as it used to. It's worn out. The muscle is not normal, and so it's going to beat weakly and quickly. And so we want to have it slow down, beat strongly, and at a normal rate. So we use the inotropic drugs, or cardiotonics, to treat congestive heart failure. We also can use it for heartbeats that are rapid or irregular, or both. And we see these are both atrial dysrhythmias and ventricle dysrhythmias. But when we're talking about heart failure, we see the following things from this picture. We see basically that the heart is not beating strongly, it is not beating forcefully, and so fluid begins to build up in the body. You see the edema of the legs and feet, you see the ascites, where fluid starts to move up into the abdominal cavity. Eventually, the lungs are surrounded by fluid. The person just becomes swollen all over. They're tired, they can't breathe, they have to fight for every breath. The kidneys can no longer handle so much fluid because the heart is not beating strongly enough. We end up with pleural effusion, which is fluid around the heart, pulmonary edema, in which there is fluid in the lungs. And generally speaking, the person is just exhausted, and it takes everything they have just for the heart to beat and to get some circulation going. Back in the old days, this had a name, they called it dropsy. So if you've ever heard of the term dropsy, that's an old-fashioned name for congestive heart failure with edema. Sometimes you'll still hear your grandparents say, you know, yeah, he died of dropsy. And basically what they're talking about is congestive heart failure. We see here what a normal heart should look like compared to a congestive heart. So you see the normal heart is smaller. It has plenty of room in both the atria and the ventricles. But when the heart has been affected to where it has to work so much harder to pump blood, the harder it works, the more the muscle builds up. And that's true of all of our muscles, and that's a good thing when we're talking about your biceps or your triceps, but it is not a good thing for the heart muscle, because you see hypertrophy of the heart muscle that causes the ventricles to be smaller. They don't hold as much. They push up into the atria, which also becomes smaller. The heart is overworked. It can no longer pump efficiently, so it tries to make up for it by pumping quickly. So a quick, weak heartbeat cannot help those fluids get where they're supposed to go, and the whole body is affected. So the cardiotonics, particularly digoxin, our biggest worry with digoxin is digitalis toxicity. And so we will draw serum digoxin levels to verify that the person is within normal limits. Now, one important thing to remember is that the amount of digoxin that is helpful or therapeutic is not all that much different from the amount that is toxic. And so it is very easy for someone to get digtoxic, especially the elderly. There are a couple of look-alike, sound-alike drugs, digoxin and digitoxin. They are not the same. Digoxin is given for congestive heart failure. It's taken routinely by mouth. Digitoxin is something entirely different. The most important thing to remember is this concept of digtoxicity. The therapeutic level for digoxin in the body is 0.5 to 2 nanograms per milliliter. Remember what we're talking about when we're talking about nanograms. Very, very tiny amounts. Toxic levels is just a little bit above that, 2.5 nanograms per milliliter. So if you drew a milliliter of blood, the amount that's in a TB syringe, you should only have 0.5 to 2 nanograms if you're taking digoxin. There is what they call an inverse relationship between potassium and digoxin. So if you are taking diuretics, remember the risk is already there for the average diuretic to get rid of potassium. So your potassium level is going to be low. When your potassium level is low, but you're taking digoxin, the risk goes up that your digoxin level is going to be high. So it's very, very important to particularly watch the elderly, because sometimes the main symptoms of digtoxicity aren't easy to spot, because two of the main symptoms are fatigue and anorexia. And so if you've got an older relative, they tend to have disturbed sleep, so they'll fall asleep during the day and not be able to sleep at night. And they don't always have the best appetites in the world, so this can be more difficult to spot in somebody who's more elderly. So always watch the relationship between a patient's potassium and the dig levels. And so sometimes what you'll see is maybe a little elderly person who already might not have been eating as well. They're more tired than usual, they're not eating, they just are not themselves. They might be weak and even have some falls. And so the family takes them to the hospital and they see potassium levels below 3.5, while the dig levels are higher, 2 nanograms per milliliter or greater. One important thing when you are taking or giving a patient digoxin in the hospital, as well as teaching the patient and their family how the patient should take it at home, is to take apical pulse. You want to count the apical pulse for a minute, and if it's under 60 beats per minute, you want to hold that digoxin. The most common digoxin dose is 0.125 milligrams, very small dose, but very important that it's adhered to. So if the apical pulse is below 60, you want to hold it. And you're going to notify the physician if you're in the hospital setting and tell the patient that they need to hold it at home too and get a hold of their doctor.